Hey guys, how you doing? Alright, so welcome back. Today we're going to talk about acute coronary syndromes. We'll discuss the medications. Oh yes, the meds we use in ACS. Now as you know, ACS is probably the most important thing you'll be dealing with if you're in internal medicine. If you are in the ER, you'll always be seeing patients walking in with chest pain, coronary syndrome, and you gotta do something about it, right? Alright, let's get to the management part. So, ACS, now that's the little hard drawing, it's actually crying because of the ischemia, it's dying now. Coming to the drugs, so how we categorize drugs is based on their mortality benefit. The first one, which always gives you a mortality benefit, so these are like sure shots. You should never ever miss to give them, okay? Then there are a few drugs which can be used sometimes, but not always. And then those drugs which are good to give, but they really don't have any mortality benefit. Okay, so which drugs are in the always class? First, aspirin. Yes, that's the golden drug. Always give aspirin, okay? Except we'll talk about the exception. Next one is thrombolytics. The third one, angioplasty, primary angioplasty. We'll talk about it as well. Then beta blockers, yes, they reduce mortality big time. Okay. You also want to give a statin. Might want to add clopidogrel or prasugrel. We'll discuss their indications, okay? Now drugs that sometimes lower mortality are ACE inhibitors and your ARBs. What are the cases in which they lower mortality? In case when you have a lower ejection fraction, which would be when the infarct is on the left side and causes a systolic dysfunction, okay? And the drugs which never lower mortality but should be given are your oxygen, morphine, nitrates, calcium channel blockers, lidocaine, and amiodarone.